Hello there and welcome to another video. Today I am going to talk about dangers of eating garlic that nobody talks about and you may not know. Garlic is generally considered safe for consumption and is even recognized for its potential health benefits. However, there are a few potential dangers associated with eating garlic, particularly in certain situations or if consumed excessively. It's important to note that these risks are relatively minor for most people and that the majority of individuals can safely enjoy garlic as part of a balanced diet. Here are some potential concerns. Digestive issues. The digestive issues associated with eating garlic are generally minor and temporary. Some of the potential digestive problems include heartburn and acid reflux. Garlic can sometimes trigger heartburn or worsen symptoms in individuals who are prone to acid reflux. This is because garlic contains compounds that may relax the lower esophageal sphincter, allowing stomach acid to flow back into the esophagus. Indigestion and upset stomach. Garlic has a strong flavor and contains compounds that can irritate the lining of the stomach in some individuals. This may lead to indigestion, discomfort, or an upset stomach, particularly when consumed in large amounts or on an empty stomach. Gas and bloating. Garlic contains fructans, a type of carbohydrate that some people have difficulty digesting. This can result in the production of gas and lead to bloating and discomfort, especially in individuals with irritable bowel syndrome, IBS, or other gastrointestinal disorders. Diarrhea. In some cases, consuming excessive amounts of garlic may act as a laxative and cause diarrhea. This effect is more likely when garlic is consumed in concentrated forms, such as garlic supplements or raw garlic cloves. It's important to note that not everyone will experience these digestive issues, and the severity can vary from person to person. If you are prone to digestive problems or have a sensitive stomach, it may be beneficial to moderate your garlic consumption or experiment with different forms of garlic, such as cooked or roasted garlic, which can be gentler on the digestive system. If you consistently experience severe or persistent digestive issues after consuming garlic, it's advisable to consult with a healthcare professional for further evaluation and guidance. They can help determine if there are any underlying conditions or sensitivities that may be contributing to your symptoms. Allergic reactions. Allergic reactions to garlic are relatively rare but can occur in certain individuals. Some of the potential dangers associated with allergic reactions to garlic include skin reactions. Allergic individuals may develop skin symptoms such as itching, redness, swelling, or a rash after contact with garlic. This can happen when handling or cutting garlic, as well as when consuming it. Respiratory symptoms. In some cases, garlic allergy can lead to respiratory symptoms such as nasal congestion, sneezing, runny nose, coughing, or wheezing. These symptoms may be similar to hay fever or other allergic respiratory conditions. Digestive symptoms. Allergic reactions to garlic can also affect the digestive system, causing symptoms such as nausea, vomiting, abdominal pain, or diarrhea. Severe allergic reactions. Anaphylaxis. Although rare, severe allergic reactions to garlic can occur. Anaphylaxis is a severe and potentially life-threatening allergic reaction that requires immediate medical attention. Symptoms of anaphylaxis may include difficulty breathing, swelling of the face, lips, or throat, rapid heartbeat, dizziness, and a drop in blood pressure. If you suspect you have an allergy to garlic and experience any of these symptoms after exposure, it's important to seek medical help promptly. An allergist or healthcare professional can conduct tests to determine if you have a garlic allergy and provide appropriate advice on avoiding garlic and managing potential allergic reactions. If you have a known allergy to garlic or other members of the allium family, such as onions or leeks, it's crucial to carefully read food labels, ask about ingredients when dining out, and be cautious about cross-contamination in food preparation to avoid accidental exposure. Interaction with medications. Garlic may interact with certain medications, particularly those that are metabolized by specific enzymes or have anticoagulant, blood-thinning properties. Here are some potential dangers associated with the interaction between garlic and medications. Blood-thinning medications. Garlic has natural anticoagulant properties, meaning it can potentially thin the blood and inhibit blood clotting. If you're taking blood-thinning medications like warfarin, aspirin, clopidogrel, or other anticoagulants, combining them with garlic could increase the risk of bleeding or bruising. It's important to consult with your healthcare provider about the potential interactions and any necessary adjustments to your medication regimen. Medications metabolized by 450 cypriot pounds enzymes. Garlic may affect the activity of certain enzymes in the liver, particularly the 450 cypriot pounds enzymes responsible for metabolizing various medications. By interfering with these enzymes, garlic can potentially alter the metabolism and effectiveness of certain drugs. It's advisable to discuss the use of garlic with your healthcare provider if you're taking medications that are metabolized by the liver. Immunosuppressant medications. Garlic's immune-enhancing properties could theoretically interfere with the effectiveness of medications used to suppress the immune system, such as cyclosporin or tacrolimus. If you are taking immunosuppressant drugs, it's crucial to consult with your healthcare provider before consuming garlic supplements or making significant changes to your garlic intake. It's important to note that the interactions between garlic and medications can vary depending on the specific medication, dosage, individual health factors, and the form and amount of garlic consumed. Always consult with your healthcare provider or pharmacist to discuss potential interactions and get personalized advice based on your specific medications and health conditions. It's worth mentioning that the interactions mentioned above are typically associated with concentrated forms of garlic, such as supplements or extracts. Moderate consumption of fresh or cooked garlic in culinary amounts is generally considered safe for most individuals without significant drug interactions. Increased bleeding. One potential danger associated with eating garlic is an increased risk of bleeding, especially when consumed in excessive amounts or in concentrated forms. Here's why garlic can pose a risk of increased bleeding. Antiplatelet activity. Garlic contains compounds that can inhibit platelet aggregation, which is the process by which blood cells clump together to form clots. This antiplatelet activity is similar to the effects of aspirin and other blood-thinning medications. While this property can have some health benefits, it also increases the risk of bleeding. Interaction with anticoagulant medications. As mentioned earlier, garlic can interact with medications that have anticoagulant effects, such as warfarin or aspirin. Combining garlic with these medications can further enhance the blood-thinning effect, potentially leading to an increased risk of bleeding. Pre-existing bleeding disorders. Individuals with pre-existing bleeding disorders or conditions such as hemophilia or von Willebrand disease may be more susceptible to the blood-thinning effects of garlic. Consuming garlic in excessive amounts may exacerbate their bleeding tendencies. It's important to note that the risk of increased bleeding from consuming garlic is generally higher when consumed in concentrated forms, such as supplements, oils, or extracts, which are more potent than fresh garlic cloves. Moderate consumption of fresh garlic as part of a balanced diet is unlikely to cause significant issues for most people. If you have a bleeding disorder, are taking anticoagulant medications, or have concerns about increased bleeding risk, it's crucial to consult with your healthcare provider before making any changes to your garlic consumption or starting any garlic supplements. They can provide personalized advice based on your specific situation and help you manage any potential risks. Odor and taste. The odor and taste of garlic are not inherently dangerous, but they can be perceived as unpleasant by some individuals, and there are social considerations to keep in mind. Here are some aspects related to the odor and taste of garlic. Bad breath. Garlic is notorious for causing bad breath, which can persist for several hours after consumption. The compounds released when garlic is digested can be carried through the bloodstream to the lungs, where they are exhaled, resulting in garlic breath. While bad breath itself is not a danger to health, it can be socially undesirable or cause personal discomfort. Body odor. Garlic's pungent compounds can also be released through the skin when consumed in significant amounts. This can lead to a garlic-like body odor that some people may find unpleasant. Again, while not dangerous, it can be a social concern for individuals sensitive to these odors. Sensitivity to taste. Some individuals may find the taste of garlic overpowering or unpleasant, which can affect their enjoyment of certain dishes or culinary experiences. Personal taste preferences can vary significantly, and for some people, the strong flavor of garlic may be a deterrent. While the odor and taste of garlic can be bothersome to some individuals, it's worth noting that these effects are temporary and generally not harmful. Many people find the flavor and aroma of garlic enjoyable and appreciate its culinary and health benefits. If you are concerned about the odor or taste of garlic, there are some strategies you can consider, such as chewing fresh parsley, drinking lemon water, or using mouthwashes or breath fresheners to help mitigate the effects. Cooking garlic can also mellow its flavor and aroma, making it more palatable for those who find raw garlic too strong. Ultimately, the impact of the odor and taste of garlic is subjective and can vary from person to person. It's important to be considerate of others' preferences and cultural norms when consuming garlic in social situations. It's worth noting that these risks are generally associated with consuming excessive amounts of garlic or in individuals with specific sensitivities or medical conditions. For most people, consuming garlic in moderate amounts as part of a varied diet is unlikely to pose significant dangers. As always, if you have any concerns or specific health conditions, it's best to consult with a healthcare professional for personalized advice.